One of the biggest issues that you have with your localized vaginal estrogens is that you experience an itch or that you experience a thrush from this. And therefore, you don't want to use any of your vaginal estrogens that your doctor has given to you, or you feel it's not right for you and you give up on the treatment altogether. Firstly, this is such a common issue. With these preparations and lots of the localized vaginal estrogens, I can't tell you how many patients come back and tell me that it didn't work or that they're getting an itch and actually they want to come off it altogether. But there are real good reasons of why that's happening to you. Let me explain to you, and also what you can do to make sure that localized topical vaginal estrogen goes on to help you with so many of your symptoms of genitourinary syndrome lactation, also symptoms such as urinary tract infections, painful sex, painful smears, soreness of the vulva and the vagina, dryness that you get, or you might actually get the opposite, which is a watery discharge. You can also use low-dose topical vaginal estrogen to treat stress incontinence or urge incontinence or pelvic organ prolapse. Yes, localized topical vaginal estrogen helps with so much of that and so much more. And let me tell you how you can make it work for you if you're one of those individuals that experiences an itch or a soreness by using the preparation, and also if it triggers off your thrush. So for the purpose of this video, as a demo, I'm just going to show you estriol cream. This is available on the NHS, and the reason that you experience any irritation with this is because the skin around the vulva and the vagina and also around the perineum right at the bottom is ever so fragile. So when you introduce the cream back into that, the skin cells just go, oh, I don't like it, and repel against that, and that's why you get the itch. So as the tissues are healing and getting better, that itchiness and that discomfort happens because the immune system wants to repel the estrogen. The estrogen cream can also change the pH and the microbiome of the vulva and the vagina and the environment in the vagina. This can make it more susceptible for the yeast to grow. So that is why you can also experience a yeast infection. So in that case, stop using your localized vaginal estrogen and use a very good vaginal moisturizer such as Yes or Sutil or anything that works until the itch or the soreness gets better. Then go back in with your vaginal estrogen alongside your vaginal moisturizer, and you might want to just start at a very low dose of once a week or twice a week alongside your moisturizer. Now, if you've got a yeast infection and you've had a swab and we know that it's a yeast infection, then it could be that you need also treatment for that alongside the estrogen treatment so that you can get the whole area treated at the same time. It might not be the localized vaginal estrogen that's irritating you. It could be the applicators that come with it. Yep, some people actually find these are the thing that irritated them, causing burning or itching in the area, particularly at the bottom of the vulva as they're trying to put this inside to treat the vaginal tissue. So in that case, then you might want to use loads of moisturizers alongside the applicators. That could be whichever moisturizer or a good lubricant that works for you. Use that on the applicator and then apply that alongside it so that it's comfortable for you. It could also be that actually, yes, you do have a sensitivity or an allergy to some of the ingredients or one ingredient in the cream. It could just be a tiny bit of that in the cream, and that's what's causing your vaginal soreness. Then go back to your doctor and please try and look for alternatives, because now we have so many different options when it comes to localized vaginal estrogen on the NHS. We've got Blissful gels, we've got cream, we've got pessary, we've got E-string, ring pessary. Anyway, the options are vast, so speak to your doctor. Finally, it could be alongside your vaginal atrophy, you have to have a consideration for another diagnosis, such as vulval lichen sclerosis. And it could be that it's the vulval lichen sclerosis that needs treatment with localized steroids to bring the soreness and the itching and the pain down. And then you use that alongside your localized vaginal estrogen, because yes, you can use localized vaginal estrogen for the management alongside your treatments for lichen sclerosis as well. And it could be that your doctor needs to refer you to a vulval dermatology specialist if they still can't get on top of it, and also ask your doctor to examine you. Have a look at the skin, have a look at your skin yourself, examine your vulva, know what your skin looks like, know what your normal is. But please, the bottom line is that it's not you, it's trying to find the right combination of low dose topical vaginal estrogen for you. And then also it could be that we need specialist input, but don't give up on localized vaginal estrogen to treat your vaginal atrophy. As always, if there's any questions, leave them down below.